Hello, my name is Guillermo Valdivia. I'm a 4th semester nursing student at LA Harbor College, and today I'm going to be talking to you about the abdominal thrust, relatively or previously known as the Heimlich maneuver. So my part I'm going to be talking about is children under 1 year old, so mostly infants or babies. So now let's ask, why are babies most commonly at risk for choking? So to begin with, babies are very curious creatures. They're very young and they're growing their motor skills. So they like to grab things and put things in their mouths, specifically smaller objects. That leads to the next thing. Babies have a smaller airway and aren't able to cough things out as much, so they're relatively prone to being choking on an item. Now, let's talk about ways we can prevent this. So the number one thing we want to do is always supervise meal times. You never want to have a 5, 6, or 10-year-old child feed their baby or your baby. You want to be there at all times. Now the other thing you could do, second important thing, is you want to go ahead and introduce foods at the right time. Sometimes babies' teeth are coming in at different intervals, and you don't want to introduce foods too early where they can choke on. Now the third thing that we already talked about is the size of their throat. So their throat is actually very small and relative to an adult human being. They aren't able to forcefully cough up any items that are logged in there. So they struggle a lot more with things that are in place in their throat. Now let's talk about what we can do in the case that the baby is choking. So the first thing we want to do is always assess the situation. Now, babies typically or usually cough when they are eating. It's normal. Sometimes they're being introduced to new foods and they aren't used to the texture of the food. Now, if you feel as though the baby isn't making any noises, starts to become blue, or faints, you want to immediately call 911. Okay, so now we're going to move on to the actual procedure, the abdominal thrust, or the Heimlich maneuver, as some previously know. So it's relatively simple, it's not too complicated, but the important thing to do is to remain calm. Like I said previously, if your baby becomes blue at the lips, isn't making any noises, or is unconscious, that is an indicator to immediately call 911 and begin CPR. Now if your baby is still choking, making noise, or still conscious, but they aren't able to get the food out, we're going to give a little bit of help. So the first step you want to do is you want to cup the baby's chin with your hand. And the way you do this is you do like this, and then you'll have the baby laying on your forearm. Now what you're going to do is you're going to find the space between the shoulder pads, and you want to make sure that you aren't choking the baby, so you want to just grab them right by the head, but not on the neck, because that will actually choke them. You're going to grab it right by the head. We're going to look between the space between both shoulder pads, and we're going to give them 5 hard-hitting back blows. Do not hesitate, because these will help. So if you're going too soft, it might not be helpful. So we're going to go 1, 2, 3, 4, 5. Now the next thing you're going to do is while you're down here, you're going to go ahead and switch hands. And you're going to go ahead and cuff the back of the babies, giving it support while holding the front. And now on this forearm, you're going to support the back of the baby's head. And now you're going to go ahead and compress the chest 5 times with 2 fingers. You're going to go 1, 2, 3, 4, 5. Now at this point, if you haven't called 911, go ahead and do so if the baby still hasn't been able to get the food item out. In this case, if the baby does get the food item out, you are okay. But there could be an instance where you are doing this repeatedly and the item doesn't come out and the baby loses conscious, becomes blue, or just stops making noise in general. You would go ahead and call 911 and start CPR immediately. Now the way you would do CPR in this instance, let's say I'm giving 5 back blows. 1, 2, 3, 4, 5. Come back. 1, 2, 3, 4, 5. Baby goes unconscious. We're going to go ahead and lay them on a hard surface. This case is the floor. It can be on a table, but it needs to be sturdy. And what you're going to do is you're going to go ahead and compress the baby's chest just like you were doing previously with 2 fingers. And you're going to do it 30 times. 25, 26, 27, 28, 29, 30. Now when you're finished the 30, you're going to go ahead and give 2 rescue breaths. You're going to go ahead and tilt the head back, pinch the nose. Now you would actually make contact with the baby's lips, but you would give it 2 rescue breaths and then continue CPR 30 times and then continue after those 30 compressions with 2 rescue breaths until 911 arrives. Now, you always want to time or to keep track of how long the baby's been unconscious for. That's a good measure of knowing how long the baby has been unconscious. But like I said, you always want to remain calm and stay calm. If you do have people around you, you want to go ahead and direct someone to call 911 while you are doing CPR. If you need to do CPR while you are by yourself, you will start CPR, you'll do a full round of 30 compressions, 2 rescue breaths, then you would call 911 and stay on the phone with them while you do CPR.
Hi, my name is Haley Conlin, and I am a first semester LA Harbor College nursing student. Today I'm going to be teaching you how to perform the Heimlich maneuver and when to know to perform the Heimlich maneuver in hopes of being able to save your child's life. So this is my niece Susie. She's going to be helping me in the video today. She is 4 years old, so I'm going to be teaching you how to do it on children that are 4 years and older. So there's this myth that children 4 years and older are better knowledge that they don't put things in their mouth, but that's not true. Anything that's still at hand level,
are choking food.
yeah, anything that's still at hand level that they can get to, they will put in their mouths. So you must be careful. So let's just say you're at dinner with your child and they're eating edamame or some type of grapes and they choke on a piece of food.
But you always do protein.
Yeah, we always eat protein. Okay, so start choking, Susie. So if your child's making noises like that, most likely they ate a piece of food that just went down wrong. And if they're choking and if they're coughing like that, means that they're still getting air into their body. So if they're coughing, cough, get down quickly to their level and hit their back like this. Hit their back like this, hard. 1, 2, 3. And hopefully they're fine and they get it out and they're okay, right? And if you don't get it out by 3, maybe by the 4th or 5th hit, you will get it out. So you're at dinner and then they look like they're scared and they're not making noise. That means that there's an occlusion in the throat and they're not getting any air enough to even cough it out. So at that point, go like this. At that point, don't cough, don't cough. They're choking. You have to get down and do the Heimlich maneuver on them. And that is when you place your hand like this and get another one and you push up. You push up and you push up 3 times. And hopefully that will help expel the grape or the edamame out of their mouth. Better? Yes. Okay, so let's say your child at dinner, you haven't been noticing them because you're busy and they're choking and they're starting to turn blue and you see them and they're not well. They have a bluish tint to them. That is an emergency and you need to call 911 immediately because that means that your child is cyanosis and they're not getting any air. So immediately, you could start the Heimlich maneuver to see if you can get it out. You could start it 1, 2, 3. Or if it doesn't get out, you immediately say, call 911 to anyone else that's in the house, or if someone else is not in the house, you can try to just call somebody else. Good job, Sue.
That's what I was gonna say.
Yeah. So that's just mostly what you can do to help save your child and anyone else in your neighborhood that has children. Just give them knowledge on how to save your child and perform the Heimlich maneuver. Thank you.